I think we all know that we have a problem in the United States, and indeed it is worldwide, in the wealthy countries of people declining vaccination. Now, these numbers are not huge. They're relatively small percentages of people, but they're often pockets of people that can lead to the acquisition of disease and the rapid spread if a particular community or subgroup doesn't vaccinate. And as some of you will recall, vaccines are not 100% effective. So, one of the powers of vaccination is undercut when we have growing numbers of people not vaccinating. The reason ethics can help here is, I think, scientists often believe that if you get the facts straight, then people would do the right thing. Now, I know this not to be true from life in my own house. Anybody who's been a parent, anybody who's dealt with their spouse urging them to do certain things, as I have, that might be beneficial for them but don't get done, knows that the facts alone do not drive behavior. In fact, in ethics, we have a fancy term for this. We call it the naturalistic fallacy. Is does not imply ought, or facts do not imply values, if you want to put it that way. The response of the vaccine community, both at the basic science level and within public health and medicine, has been to continue to pound on the idea that if we got the facts out there, the American people will stop putting themselves and others in other countries at risk and wind up vaccinating. But that has not proven true. So how can ethics help? Well, I began to look at this and I realized that there was a different problem. And you can check this out at your home institutions if you have a medical school or a hospital or a nursing home nearby, or if you know people in nursing homes. It turns out that the vaccination rate for flu, just let's focus on that as a case example, among healthcare workers is 60%. Public, under 50, probably around 48. Healthcare workers, 60. And in many nursing homes, 10%. So, people who should know facts are not acting on the facts themselves. And why might that be? So that puzzled me, just being a humble old philosopher, as to why folks wouldn't, in the healthcare field, do it. But here's a worse problem. If your nurse or your nurse's aide or your doctor or your respiratory therapist doesn't vaccinate, they're not a good role model. And it's hard to go out to the public to say vaccinate if you will, the healthcare community and the scientific community don't vaccinate. So it's important to figure out, well, what's the source of reservation among the healthcare workers? So there is an empirical side to bioethics. We started to do surveys and studies, and I began these when I was in Philadelphia at the University of Pennsylvania and the Children's Hospital there, and then I carried them forward to NYU where I am now. And we quickly found out that the same worries that the public has are the same worries that healthcare workers have. They're safety worries. And the other reason I choose not to do this, and I have a right not to do it because I have a right to choose. And control over my body is important, and we know that American individualism and commitment to liberty is very strong in the culture, growing, one might even argue, respect for autonomy and personal choice, very, very strong value. So, sadly, I have to tell the NSB, facts are not going to overcome this. And my idea is to take a different route and use ethics in a different direction. And it's a two-pronged strategy. One is to work on the healthcare workforce and see if we could boost those rates up. Two, and partly because that's important to do, it turns out they're the most exposed people in the entire world to flu, and it sets a good role model. If you could do it there and then put up a banner and say we're a 100% vaccine zone, if I can get you to ask when you go to the nursing home, are these caregivers vaccinated? Or if you have a home care program, you should ask, are you vaccinated? We want to make that part of the culture. And we want to make a big deal out of the fact that healthcare workers lead the way. That's a normative policy, trying to move them as exemplars. The other way is to try and move the public by trying to convince them that it's the right thing to do. Not just the facts, but they have a duty to do it. If you add the ethics to the facts, you can get someplace. If you just keep spinning the facts, you aren't going anywhere. Remember, facts don't make people behave. What can we do with the healthcare workers? So I decided, how about we take a little voyage into their codes of ethics? see what they say they're supposed to be doing. Well, it turns out every code of ethics for doctors, nurses, respiratory therapists, pharmacists, social workers leads off with patients first. We are committed to patients first. And I didn't bring them, but I have lots of slides to show you that they all start. In fact, you couldn't read these codes without breaking into tears. They're so moving. They're patients first, and we have to subjugate our own interest to the patient. The patient must come first. Okay. Second principle that they invoke, do no harm. We all know that one. It's all over the codes. The third one, protect the vulnerable. And by the way, I didn't go into it, but the group most adversely affected by flu are babies, the very old, the immune suppressed, post-cancer therapy, post-transplant people. Anybody whose immune system isn't hardy is most at risk of getting in big trouble with the flu. That's where those deaths are. So those are three principles that I use now to torture healthcare workers. I didn't make them up, they did. They imposed them on themselves. They're all in their codes. I did add one, which is be a good role model. So now I have a four-legged stool. Patients first. It doesn't say patients first unless I choose not to vaccinate. Do no harm. It doesn't say do no harm unless I choose to invoke my religious beliefs. It doesn't say protect the vulnerable unless I choose to stay home. It says do these things as a duty as a healthcare worker. And indeed, by the way, for those of you interested in the religious side, there is no major organized religion that is opposed to vaccination. We now have a mandate that you must vaccinate as a healthcare worker. New York State, I work with the health commissioner this year, past flu season in LA County have issued mandates that you must either vaccinate or mask or get fired. At the Children's Hospital of Philadelphia, we fired 7 nurses who wouldn't vaccinate 3 years ago. Now everybody vaccinate and that controversy's over. Went around and explained the ethical duties of healthcare workers, tried to make sure that they put up big banners and signs and everybody wears a badge saying, I got my vaccine, did you, which is the role model thing, which is super powerful in driving behavior in this sector. There are 400 healthcare systems today that are now on mandate. 19% of the healthcare workforce in the United States has moved to mandate, and I hope that we get to 100% soon enough. But we're moving fast. This is rapidly being adopted. Have a state requiring it, a county requiring it, Kaiser requires it in their system, DOD requires it in their system now. So it's moving along in a very commendable way. At the other end of the spectrum, why should I vaccinate as an ordinary citizen? Well, here we want to make sure that you understand that you're vaccinating not to protect yourself, although you do, but you get more impact if there's herd immunity, right? And I won't review that with this group. We'll just presume you all know that if you get herd immunity, you get much more protection because viruses have a hard time jumping from one person to another. In flu, it takes plus 90% to generate herd immunity. So if you don't vaccinate, even though you may have some reason, if you keep that rate below 90%, you stand a chance of putting yourself in peril and you're harming your neighbor. So my next target is daycare and pre-kindergarten because it's a great vector. And so what did I do? We passed a law in New York City now that you can't send your kid to pre-K or kindergarten without vaccination. So you have to show it. Rhode Island, Connecticut, and actually New York State are now thinking about it. That's an interesting idea. And the teachers or attendants in daycare are all for it because they're tired of getting sick all the time. So you don't have opposition from that group. They like it. Who else? Transportation workers, people who are exposed on the BART, people who are exposed on the airports. Those are big vector points, again, for spreading disease, if you get them moving. And so, bottom line, build out from the hospitals, set the right example, put the moral case to them about why they have to do it, then get emulation and try to build out. If you want to achieve the public good, it's to marry the ethics properly with the facts. And I think then, and only then, and I would tell this to members of Congress who wonder sometimes, what do we got to invest in the social sciences for? Why do we worry about the ethics components? Because if you don't have those levers, you can't get positive behavioral change and you can't advance the public good. So thank you.
Wow, great. Thank you.